Okay, so it is 1:30 on the dot, and I will, Phil, are we ready to go? Are you ready to hit record?
Yes, I will hit it now.
Okay. Welcome everyone to the Survival Coalition of Wisconsin Disability Organization virtual press event to discuss the amicus brief that has been filed by aging and disability advocates from across the country and in Wisconsin in response to a legal challenge against extending Wisconsin's safer at home order. Just a few housekeeping details before we get started is that all attendees will be on mute and your video will be turned off. You can place any questions into the chat box. We will be taking questions at the end, so please use that chat box for that purpose. We will be recording the press conference and we'll make the press conference video and related materials available after the event. So I'm Lisa Pugh, and I am the Executive Director of the ARC Wisconsin and co-chair of the Survival Coalition of Wisconsin Disability Organizations. The Survival Coalition is comprised of more than 30 statewide organizations that advocate and support policies and practices that lead to the full inclusion and contribution of people with disabilities. Today, more than 30 national and state disability and aging advocacy groups filed an amicus brief with the Wisconsin Supreme Court in response to a petition challenging Wisconsin's safer at home order. The brief outlines how lifting that safer at home order prematurely could have life-threatening consequences and cause irreparable harm for people with disabilities and older adults who already face a significantly high risk of complications and death if they are exposed to the virus. So today you will hear from attorneys and disability and aging advocates who will discuss the brief as well as the risks to this specific population. You will also hear from a daughter who lost her elderly parents to COVID-19, as well as a Wisconsin resident with a disability who receives daily cares and in his home and lives with his elderly father. Again, please type your questions in the chat box. Our speakers will be available to answer your questions at the end of the event. First, I'd like to start with introducing you to Shira Wachschlag, who is the legal director for the ARC of the United States and also representing the ARC Wisconsin. Shira was the lead attorney coordinating the drafting of the brief on behalf of the Survival Coalition and 30 national and statewide groups. Thank you to Shira for attending today.
Hi, everyone. So as Lisa said, we filed this brief yesterday on behalf of over 30 groups, both national and state groups, explaining the significantly heightened risks to people with disabilities and older adults who make up over 1 million people in Wisconsin of experiencing life-threatening consequences from COVID-19. Nationally, COVID-19 has infected nearly 1 million people and caused approximately 54,000 deaths. And over 6,000 people in Wisconsin have been infected, with at least 300 who have died. So in terms of going through the brief, the overarching theme was, if the safer at home order is lifted prematurely against the advice of state health officials, the disproportionate harm to people with disabilities and older adults will only worsen, putting thousands of lives in immediate danger, and especially those living in group homes and other congregate settings. So I'll start kind of broadly to explain what the brief has to say, and then go through some specifics that we got into, outlining the various risks to people with disabilities and older adults. On a broad level, the brief explains that if the order is prematurely lifted, more Wisconsinites will inevitably contract the virus, and people with disabilities and older adults will experience life-threatening consequences at a far higher rate than the rest of the population. This will in turn overwhelm an already overburdened healthcare system dealing with limited supplies of crucial equipment, which will disproportionately harm people with disabilities and older adults who face an exponentially higher risk of contracting the virus in a life-threatening capacity that requires hospitalization. Getting into more specifics of why these groups are at higher risk. So the brief outlines these heightened risks and explains how each of these areas would only be exacerbated and worsened if the safer at home order is lifted prematurely. So some of these risks that we talk about in the brief include underlying conditions. People with disabilities of any age are more likely to have underlying health conditions, which put them at greater risk of serious complications and death if exposed to the virus. There's also a major issue nationwide and in Wisconsin with lack of personal protective equipment or PPE, and people with disabilities and older adults, whether they're living in congregate or community-based smaller settings, often require assistance from a workforce that cannot maintain social distancing while supporting them in their daily lives with things like personal hygiene, eating, transportation, things like that. The state and nationwide shortage of PPE puts both staff and those they are supporting at a higher risk of contracting the virus, which will only be exacerbated if the order is lifted. Going to congregate settings, many individuals with disabilities and older adults live in congregate settings such as group homes, nursing homes, intermediate care facilities, and psychiatric facilities. And the federal government has recently referred to these settings as ground zero for COVID spread. Congregate settings like these have seen rampant spread of the disease and alarming death rates. If the order is lifted, these numbers will only worsen due to greater community exposure of staff who are going back and forth out of the facilities. And there may also be lifting of visitor restrictions that are currently in place, which will also worsen the spread. There's also concerns about discrimination in medical care. People with disabilities and older adults are at greater risk of being denied life-saving medical care treatment. An uncontrolled outbreak forces rationing of medical care, a situation in which people with disabilities and older adults are more likely to be harmed due to a history of discrimination. And the last factor that we talk about that puts people at higher risk is homelessness. People with disabilities and older adults are also experiencing homelessness at a far greater rate than the rest of the population, which puts them at even greater risk, because homelessness is another factor that the CDC has identified as an additional risk factor for contracting the virus. We're all, as our group and our coalition, are just as gravely concerned about the economic and overall well-being of people in Wisconsin and nationwide with regards to the physical, psychological strain of isolation, job loss, and postponement of important medical care that's resulted from the stay-at-home order and the virus, but facing an even greater risk of exposure to a deadly virus that will disproportionately harm our communities and overwhelm already overburdened hospitals will only worsen the economic and mental health challenges that our constituents are facing.
Thank you very much, Kira. Joining us now is Michelle Pike. She's joining us from Mequon, and she has agreed to share her story of her elderly parents from Wauwatosa who were ages 94 and 92, who both tested positive for COVID-19 and died within hours of each other. We're very grateful that you're able to share your story with us today. Thank you, Michelle.
Thank you, Lisa. I want to share the story of my folks. They had been married for 73 years. Again, my dad was 94, my mom was 92. My mom was the primary caregiver for my dad, who had congestive heart failure. My mom also had some comorbidities, which also put her at high risk of catching the virus. Interestingly enough, 3 weeks before they got sick, my dad had said he wasn't concerned about contracting the virus because he was homebound and didn't leave the house. So he didn't think he was anywhere at risk of getting the virus. Unfortunately, my mom was still needing to go grocery shopping, get gas in the car. She, excuse me, she took her absentee ballot back to the city hall. She went to the bank. So we don't know exactly where she was exposed, but somehow she contracted the virus, passed it on to my father. On April 6th, my mom was diagnosed. On the 12th, on Easter Sunday, my father fell at like 4 o'clock in the morning. He was so weak from COVID-19. He fell, and we ended up having to call 2 rescue squads to come and get my mom and my dad. That was on the 12th, and then on the 18th, unfortunately, they both passed away within 6 hours of each other. Many of you may have seen the stories on CNN. People Magazine has done a story on them. Frederick Hospital is where they were taken by the ambulances, and Frederick was able to push my parents' beds together so that they were able to hold hands during that time. Sorry, getting emotional. One thing I'd really like to say is that my parents were extremely dependent on the community and the community being safe for them. And unfortunately, this virus, people don't know that they even have it. And so they're exposing folks not knowing that they're sick themselves. So I think that's true for a lot more elderly people who are still living in their own homes in the community, is that they have to depend on a community that they interact with to be safe and to be healthy for them in order for them to stay healthy also. So just thought I would share my thoughts on that. Thank you.
Michelle, such a powerful and important story, and a lot of bravery it took for you to share that today, but I think it's important for people to hear that. So thank you again.
Thank you.
Now we'll be joined by Janet Zander, who's the Advocacy and Public Policy Coordinator for the Greater Wisconsin Agency on Aging Resources, to share more concerns for Wisconsin's older adults.
Good afternoon, and thank you, Michelle, for sharing your story. And that story makes me sad every time I hear it, and yet I know that Michelle's family is not alone in what they have experienced. What we know is that COVID-19 is proving to be very dangerous for many older adults, especially those with pre-existing conditions like diabetes, heart disease, and lung disease. While older adults represent about 30% of the 6,500 plus cases of COVID-19 here in Wisconsin, they also represent 61% of those who are hospitalized, 63% of those needing intensive care, and 86% of those who have died. So they are disproportionately impacted by this disease. Many have no idea where it has been contracted, but we know it spreads easily among community members, and we're so concerned that any transition that we as a state have be done slowly and taking into great consideration the impact it has on those who are most vulnerable. Right now, about 20%, or 1 in 5 of our COVID-19 cases here in the state are people who are age 80 to 89. And about 20% of those cases result in death for those individuals. But for those folks who are 90 and older, our most vulnerable folks, nearly 1/3 of those individuals who contract the disease die from the disease. Some of these older adults reside in some of those congregate settings that Shira spoke of. These are facilities and living centers where it can be really difficult to prevent the spread of the disease. We have workers who go out and live in the communities, have families, and then need to come back in and care for these individuals. And we're concerned about the individuals who reside there, as well as the workers who have to come in every day to provide care for them. Here in our state, we have over 370 nursing homes. We have over 4,000 assisted living facilities of various different kinds. The weekly data that we now have available on the Wisconsin COVID-19 website is telling us that there are 187 active investigations, facility-wide public health investigations. Nearly half of those health investigations are in long-term care facilities. The average number of confirmed cases per investigation in these long-term care facilities is 6, but the range is anywhere from 1 individual all the way up to 54 individuals. We see how quickly it can spread. We've seen it here in our state, and we certainly have seen it across the nation. There are currently active facility-wide investigations of all types occurring in all but one of the 5 regions of our state. So this is not just an urban issue, this is a Wisconsin issue that we want everyone to be paying attention to. Our next speaker is Kitt Steiner, and Kitt is the Director of Legal and Advocacy Services for Disability Rights Wisconsin.
Thank you, Janet. I think that the prior speakers have laid out the hard, cold facts and the heartbreaking stories, at least they are to me, of what's going on in the state. So all I can do is underscore a few points. One being that this court, through this petition, as part of granting an injunction, has to balance harm. And I think that's a discussion that's going on in the community at large, and it's certainly brought to a point here in this lawsuit. It's looking at the very lives of people in our community, and balancing that against 3 weeks of economic return to health. I don't think it's much of a balance. I think it's pretty favored in one side, and that's in people's lives. And this is all kinds of folks, where this people with intellectual disabilities, people with mental illness, elderly, kids, people that are living in homeless shelters, that are in congregate settings, jails, prisons, nursing homes, psychiatric hospitals, all over. And the responses might be, well, tell them to stay home. Let us have our bowling alleys and our nail salons, and they can just stay home. But the important thing is that folks that have underlying vulnerabilities, medical vulnerabilities, comorbidities, even if they stay home, so much of the services and supports that they need, whether it's in their own home or a congregate setting, come to them. So the community spread will still come to them, even if they stay home. And I think that has to be balanced for what is an absolute hardship for the economy for a few more weeks. Another thing that we're very concerned about is the rationing of potential PPE or other medical care, like discrimination in the rationing of vent care. If we hopefully will not get to that point, and I'm just bringing up something that's good to look at before it happens and prevent against. But we are concerned about the determination that someone who has a disability that's of a certain age will be perceived as not having the quality of life as a younger person out in the regular society. And this is just not the case. And individuals have great potential, great success, great joys, and great sorrows, no matter if they have a disability or not. And we want to make sure that that's recognized throughout the state when they're thinking about what's going to happen in a worst case scenario. So that's pretty much what I wanted to say. I think it's been really important to file this brief on behalf of this very large group of individuals, and they're people that we all know. But now I'd like to pass this over to Matt Ford, who's a person with a disability and a member of Wisconsin Long-Term Care Workforce Alliance, one of the 32 organizations that signed on to the brief. Matt?
Hi, my name is Matt Ford. I'm a lifelong resident of Wisconsin. I'm permanently disabled as a result of a diving accident that I had 30 plus years ago. For the majority of that time, I've lived with my father, utilizing caregivers in our home to provide help with getting up for the day, going to bed at night, and caring for me during occasional illness and health problems. Caregivers are commonly CNAs or college students, neighbors even. Many have become like family, working for me for 5, 10, even 15 years on occasion, as a part-time job or working full-time in various healthcare positions in surrounding area, or as students hoping to gain experience, looking to become physician's assistants, nurses, physical and occupational therapists, or even doctors. I currently have 2 caregivers. One is a PA student whose semester and year was cut short at University of Wisconsin by COVID. Another has worked for me for 5 years, and he cares for 2 other quads in the Madison area to create what has essentially been a full-time job for him. Only 2 caregivers for me is fewer than what I would normally have, but due to caregiver workforce shortage, 2 people is what I've gotten by with for nearly a year. My father provides backup, but is now 76 years old, so we both fall into the high-risk category for COVID. We have little choice, but for my dad to go out grocery shopping, et cetera, for other supplies for us, And social distancing is something that I think we're used to some degree, living in the rural town of Middleton, but I must rely on healthy caregivers following rules that coming into my home. The PA student is all but moved in with us to ensure our safety. Another caregiver, should he get ill, would endanger 3 vulnerable people with disabilities, in addition to leaving us without a caregiver. They've sacrificed visits with their own friends, family, and have taken extra precautions to make sure they do their best not to contract or transmit COVID to our household. I'm extremely grateful for friends and family and fellow Wisconsinites that have followed the stay-at-home directives as well as they have, keeping those most vulnerable, like my father and myself, safe from contracting COVID. But rushing to open the state risks undoing all the careful excursions, planning, and limited personal exposure to others that all of us, myself, my father, and my caregivers, have been so careful to follow. I am as eager as anyone to get out and resume a normal life, normal schedule, moving around Madison, eating out, doing all the things we look forward to each spring and summer, but not at the risk of contracting COVID and potentially being hospitalized or even dying. I hope that they'll take their time and wait for the right time to lift the stay-at-home orders, doing best to ensure that there are many more safe, healthy activities ahead of us with conditions that make us the most vulnerable.
Thank you so much, Matt. Thank you to all of our speakers for sharing such a great comprehensive overview of the brief itself, but also the human face of who the brief is really about with regard to the importance of the safer at home order. At this time, we'd like to open it up for questions. If there are members of the media that want to type a question in the chat box, we're more than willing to address pieces of the brief, or if you have questions for Michelle or Matt, please do that. I don't think we had any in the chat box. Is there any additional comments that any of our speakers would like to? Oh, I do have one question here, and it is from Matt. Matt, it sounds like you are the employer for your caregivers. Is that right? And then does that make you responsible to provide the personal protective equipment or PPE? So what's been the situation?
I am like the de facto employee or employer. I use the IRIS program. So I am responsible for providing the PPE. And it's interesting that you bring that up. Essentially what we end up using mostly is gloves. And it's something that I've already experienced a difficult time getting a hold of. I order supplies on a monthly basis, and I generally do it at the beginning of each month. And a couple times at the beginning of, in March, I noticed that my glove shipment hadn't come. And it took some, really being persistent with the provider for my my supplies to get an answer that they were basically hanging on to those for all the Madison hospitals. Just kind of not allowing them to go out to other places, of the ways to prevent spread of the disease, it seems like, we've heard a lot about hand washing and just doing very simple things. And in addition to doing those things and wearing gloves around me, there's procedures that I need the gloves for that I can't get by without them. So, I'm responsible for it, and they're just not available anywhere. Previously, if I had gone to Menards, there might be a box in the painting department, there'd be $5, and the shelves are wiped clean. So they're just not available.
I wonder, Janet, if you might want to weigh in on a PPE question too, because I think our community-based workforce, the workers that are going in to care for people with disabilities and older adults in their homes and other smaller settings, really have not had the same access to PPE as other types of healthcare workers, right?
Right. We continue to hear that this is a significant challenge. Not only are our healthcare settings having a difficult time, but our community-based settings or providers are really having a tough time. Either orders aren't filled, they get half of what they ask for. On that ranking list, they're way at the bottom of the list. And yet, as Matt points out, they're critical in terms of our ability to prevent the spread. Both masks and gloves have been really, really hard for folks to acquire. So they're using cloth masks, which are less than they would like to be using. They're washing masks. People are sewing things. But gloves are also so important, and people are getting half of what they order if they're getting that. And yet, given the very personal care where they can't be distanced from the person to provide the care that's needed, we really have to highlight how important it is that these individuals get the supplies they need, whether they're the employer or whether it's the agency who's working with these providers. They have to have the supplies.
There's another question in the chat box that talks about, is there any group organizing PPE donations or supplies for the disability community like there are for hospitals? I'll just start out by saying I think that local communities, it's probably going to look different depending on where you are. I know that community-based providers have been told that they can access PPE by contacting their local county emergency management entity. And I would imagine there are different types of patchwork PPE movements around the state, but I don't know, Janet or Kitt, if you're aware of any of that specific.
There are resources that have been shared with our quadrant work groups, our long-term care quadrant work groups that are convened by the Department of Health Services, and they've been sharing these resources by region of the state. Whether it's a Facebook page and a group of individuals in communities who've agreed to do that, and you send them your request and they mail those sewn masks out to you, whatever the resource is, we've been sharing those resources for the long-term care community via those quadrant work groups.
Are there any additional comments that our two attorneys, legal experts have, either about the brief or about the timeline and next steps?
I think the next step is wait. At this point, everything is filed, and we'll have to see what the court. I imagine they'll respond fairly quickly, since the order doesn't have the existing order that they're being asked to enjoin only has a few weeks on it. So I'm sure we'll be hearing fairly soon.
Shira, can you speak to how the ARC of the United States is helping disability and aging advocates across the country, and why you think this had the interest of national organizations to sign on in Wisconsin?
Yeah, so the ARC has really been at the front lines of this, as all of our partners on this call have been, since it became clear how serious this epidemic was, and especially to the disability community and older adults. So across the country, we've been doing a lot of work, basically in all of the areas that I mentioned where we talked about in the brief. So making sure that people with disabilities in congregate settings are receiving the protections that they need, as well as their support staff. I personally, on the legal end, have done a lot of work on the medical discrimination issue that I mentioned as one of the additional risk factors. So there's been some concern in states around the country on medical rationing, and that's the issue of overwhelming the hospitals and healthcare systems to the extent where rationing of supplies and things like ventilators and even a shortage of medical personnel may become necessary. And there's a real concern in a lot of those what are called crisis standard of care policies, that some of these in different states have explicitly a discriminatory language against people with disabilities. In other plans it's somewhat more implicit, but have discriminatory effects on people with disabilities as well as older adults. And so that's something that we've been fighting against this whole time. As soon as it became clear that that rationing may become a real concern. And that's a real issue here, because if the stay-at-home order is lifted, or safer-at-home order is lifted prematurely, everything just becomes, the virus just continues to spread. People who are infected just continue to grow. And as we've outlined here and in the brief, people with disabilities and older adults are at highest risk of actually getting hospitalized because of being infected with the virus. There's certainly a lot of people who get the virus that may not have symptoms, but our communities are often going to be hospitalized and facing life-threatening consequences. And so we've done a lot of work to make sure that if they do need to be hospitalized, they're not at least fearing that they're not going to be receiving life-saving treatment because of discrimination. So those are some of the things we've done. We've worked on trying to address the PPE shortage for people with disabilities and their support staff, because again, even those who are living in smaller and community-based settings are facing this issue as well, because the work that their support staff does with people with disabilities and older adults is often very close in nature, and you can't necessarily social distance in that kind of support. So we've really been tackling all of these issues, both from the legal end and also the federal policy side, since this epidemic began, or pandemic, I should say. And so when we think, and these are all issues, whether there's a stay-at-home order or not, but the idea that it would be, all of these things would only be exacerbated that we're already facing and struggling with is something that is just, we can't bear to think about going backwards in that way when we've been fighting this whole time to try to make progress and make sure people are protected and receiving the supports that they need. And I think another point about, implications beyond Wisconsin is that there's not closed borders. So if one state does this, that can spill over into other states. If you're increasing the spread of the virus in one state, that has implications for the rest of the country. And so, all of these things kind of go together, and it's not just isolated to effects in Wisconsin, even though that's the specific state that case that we're dealing with here.
Thank you very much, Shira, for that overview. And we welcome everybody to read our amicus brief and to look at the considerable list of signers that include national, statewide, cross-disability organizations representing older adults and mental health and developmental disabilities, physical disabilities organizations. So thank you, everyone, for joining us today, and thank you to our speakers for sharing your expertise in today's call.
Thank you, Lisa.
Thank you.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.